Thanks, Jay. Peter Thomas is a general dentist here in Hampton and is going to talk about the often neglected part of the body, the mouth, and how dentists are impacted by all of this.
Thank you, Wendy, and thanks, Chris, for having this program tonight. A little bit of background: I've been practicing dentistry in Hampton since the early '70s, and even back that far, it became clear to me that there's a group of people, a group of our fellow citizens, who is not accessing dental care. So back around 25 years ago, Neil Hilton and I, he practices, and he's partially retired now, in Northampton, co-founded a program called Dentists with a Heart, where we gathered in our glory days, we had about 30 practice dentists. But I found that I would be seeing the same year after year. That was their dental care, the annual visit with Dentists with a Heart. And then about, Wendy, how long ago was it when the coalition was working?
What,
was that
10 years ago, 12 years ago?
Yeah. About 10 years ago, a local pediatric dentist who was assuming more than his share of the burden of taking care of Medicaid kids' dental needs, finally said, that's enough, I can't do any more, I'm bankrupting my practice. And Wendy and I see Sue out there somewhere, yeah, she was a player, and Helen, and a bunch of other people founded a dental coalition to look at options for access to dental care in the Seacoast area. And again, Neil and I and a couple of other guys came up with two options for dentists to volunteer their services. One was for dentists to see a screen population in our private practices as we could, and integrate them with our regular patient care. And another group preferred to do it in a clinic setting, and that was kind of one of the early sources of volunteer effort at Helen's family's first dental clinic. So a little bit later, a group of us again integrated the volunteer network with C-Care Health Services to provide a dental component. It turned out to be a very challenging project. Dental care, delivery of dental care is significantly different from delivering medical care. I think most of you, when you visit your primary care, you might spend 15 or 20 minutes, maybe a half an hour. Except for Jay, he'll spend as much time with me as I need. He's terrific. But then when you compare and contrast that with an appointment in a dental practice, an hour, oftentimes more than that. So the delivery of care model that physicians in C-Care Health Services could use just didn't work for the dental piece. And the dental piece withered. Fortunately, about this time, the Exeter Clinic opened a dental practice as part of their core physicians group. And they do provide some access to care. It's not as much as I would like, but it is an option. The Avis Goodwin Clinic out of Wentworth Douglas Hospital is fabulous. Families First is great. And I talked with the executive director of our dental society this morning, and he said, to my surprise, that last year, and I think we can go back further than that, 76% of the people in New Hampshire saw a dentist. I think that is astounding, and I'm sure that is, if you go to New York or California or any New Jersey, any metropolitan state, I'm sure you'd find it well below 50%. So a lot of people are accessing care, but we see on a regular basis a group of people who aren't able to. And Jay has been sending people my way for a number of years, and we're more than happy to see them. This is a group of people who are on a survival level. They're not interested in cosmetic dentistry. They're not interested in preventive dentistry. They just want to be out of pain. And we're more than happy to serve them at that level. Dentistry historically has been at the forefront of preventive efforts in medicine. I mean, public fluoridation of water supplies is probably the greatest public health success in this country. I know that most of you, when you visit your dentist, you are given a preventive message about how you can prevent particularly periodontal or gum disease, which will, as Jay alluded to, have a major impact possibly developing diabetes or cardiovascular disease, for women who are contemplating pregnancy, low birth weight babies. And there's a list of diseases that can be affected and impacted by preventive dentistry. We kind of get back to the same issue as Jay talked about with providers. Given the amount of time that needs to be invested in preventive education in dentistry, let alone dental treatment, there just aren't enough of us out there. An interesting piece of information I discovered in researching for this conversation is the utilization of emergency departments in hospitals for the raging toothaches. And I find this hard to believe. My wife Sharon, who used to be an emergency room nurse, found it also hard to believe. But I guess there's a group of diagnoses for ambulatory care sensitive chronic disease conditions. And I'm not sure how that's defined, except the diseases that fall into this category are asthma, chronic obstructive pulmonary disease, angina, hypertension, congestive heart failure, hypoglycemia, diabetes, and dental conditions. To my surprise, for this group of diseases, dental conditions responsible for 56% of emergency room visits. Now, that's not 56% overall. That's just for the diseases that I mentioned, and maybe a few other ones. While people go to the emergency room at Exeter Hospital, they're seen, they're given an antibiotic and a pain prescription, and told to go see a dentist. Where do they go? I think the biggest hole in our system right now in terms of access is for the folks who are on a survival mode in their lives and who can't make that transition from the emergency department to having definitive treatment. Do I have a couple more minutes?
About 40 seconds.
Okay, all right. Another piece is the sort of the psychosocial aspect of access to dental care. I think if you were up in the boondocks somewhere, missing some front teeth would not be an issue about getting a job. Around here, a lot of people that I see from this population are unable to work or feel so self-conscious about their appearance that they don't go look for work. And if we can just give them 6 front teeth to smile with, it can change their lives. So that's my piece. Thank you, Wendy.
Thanks, Peter.